How is endometriosis detected? Aside from laparoscopy surgery, there is no other method for officially detecting endometriosis. Biopsies taken during surgery help provide conclusive evidence of the presence of endometriosis. Aside from surgery, there are other investigative methods used to help detect endometriosis. Ultrasound is the first line of imaging used for assessing women showcasing endometriosis symptoms. Ultrasound can be used to identify the following: ovarian cysts, large tissue clumps, or scarring and endometrial tissue that may have embedded itself in the bladder or bowel. It's not the best method to identify small or superficial lesions, so a lot can be missed, because even the smallest, most superficial lesion can result in immense pain, depending on its location. The lack of detection and resulting finding that the patient is negative for endometriosis is effectively a denial of their experience. The general experience and therefore understanding amongst women with endometriosis is that ultrasound rarely picks up on endo. Women can undergo several ultrasounds before they are put forward for an MRI and then surgery. The latter usually confirming endo that was never detected prior to via ultrasound. What seems to be lacking is the training of sonographers, those who perform ultrasounds, and radiologists, those who interpret imaging, in the detection of endometriosis. On top of that, it's been said that the ultrasound, which is almost 70 years old, could use further study into improving its accuracy for detecting ovarian endometriosis and deep endometriosis, effectively meaning that its capabilities are yet to be fully realized when it comes to endometriosis. So to conclude, due to the lack of training and awareness on endo detection, ultrasound tends to provide suboptimal detection of deep endo. Moving on to MRI. MRI offers the best form of imaging for a systemic condition like endometriosis that affects the whole body. It can detect deep endo in the ovaries, for example cysts, in the bladder, the bowel, and extrapelvic areas. It can also pick up on inflammation and in some cases the presence of superficial lesions too. With endometriosis being present in all parts of the body, a multidisciplinary team, MDT, basically a group of trained staff with different backgrounds, different areas of expertise within healthcare, is required to offer better reporting accuracy. However, with all that MRIs can do, what they can't do is definitively confirm endometriosis. As with ultrasound, what wasn't detected in a scan has later shown up in surgery. Side note, for all that MRI imaging may show up with regards to endo, not all radiologists have been trained to adequately detect it. And last but by no means least, we have the CA125 blood test, also known as cancer antigen 125. It's a non-specific test, meaning that it doesn't point to a specific diagnosis, but it's been used to detect endometriosis and the growth of cysts like endometrioma. It's not a definitive diagnostic tool for endo. The test has limitations, with readings potentially affected by other factors, such as menstrual cycle phase, other gynae conditions, for example pelvic inflammatory disease, and even non-gynae conditions like liver disease. Therefore, CA125 results should be interpreted in conjunction with clinical evaluation, imaging, and other diagnostic tests. So that's what we seem to have established so far with regards to non-invasive endodetection. Such testing has been pretty standard practice since the 80s, would you believe? So over 4 decades ago. We've only seemed to have progressed with regards to accuracy, which feels like a bit of a stretch. And we're even behind in that space. What does the future hold? With AI and recent research into genetics, new forms of non-invasive diagnostics will hopefully soon be emerging. Next up, I'll be sharing the future of endometriosis diagnosis. Stay tuned.